what can our employees and their families expect the first time that they visit the Employee Health Center?
Well, we hope they're going to find a beautiful facility. I know that the city is working in developing just a gorgeous facility that is going to have plenty of space and exam rooms that they would find very similar to what they're experiencing in any physician practice that they're currently seeing. We will have ways for them to make appointments and to get easy access to that clinic. Our clinics typically have minimal wait times, so it'll be something where they'll come in, they'll find it an efficient practice. I think probably the biggest difference that they'll notice, and at least we certainly hope they notice, is the time that the employee or their dependents will have with the physician or the nurse practitioner. In many cases, most physicians probably spend somewhere between 7 and 10 minutes with the patient in a standard-based practice. We're operating under a different model here. The physicians are paid a flat salary, and they're not focused on a fee-for-service type of payment structure. And so I would expect that employer, their dependent, would spend at least twice to 3 times the amount of time that they would in a traditional physician's practice. We really are what we call patient-centered. We really want that to be a tremendous experience for that employee, and not just address potentially the cold or the earache, but also try to understand from a health and wellness perspective, and can we look and make sure that we're identifying any chronic disease for them, but also to be able to provide some education. And that extended period to which they'll have opportunities to meet with that physician or the nurse practitioner is something that I think they're going to find a significant benefit.
So if an employee or a dependent has a chronic disease, let's say diabetes as an example, or maybe they need to prevent from diabetes, is this staff going to be able to help them either prevent reaching type 2 diabetes, or if they have type 2 diabetes, are they going to be able to give them the type of management care and ongoing coaching to improve their situation?
Absolutely. Our goal there is to provide a comprehensive approach, and I will tell you that I think that for those patients that are under the care of a physician, we still think we can be supportive there. We can help with lab work and various other services that would be conducive to the promoting and fostering their relationship with their current provider. But in many cases, many employees don't know that they suffer from a chronic disease, so our goal is to provide education, screening, and various other tools and evaluation methods to make sure that if they are suffering from a chronic disease, one, they know about it, and two, that they know how to treat it, and then provide the ongoing management of that condition for them to either minimize the impact of that condition, or to hopefully get them off the medications and provide regimes that would allow them to return to more of a healthy lifestyle.
Brian, obviously any doctor's office it has some limitations, and there's sometimes a specific issue requires a specialist. How will our physicians, or your physicians rather, handle referrals?
Well, we have relationships with many of the community physicians here, and I think our goal is that we want to support and work with the physicians that are in the network. So if they have recommended specialists that they are currently seeing for a particular condition, we want to work with them and make sure that that specialist understands what's happening at the clinic. We can fax those notes to the clinic. We can electronically send them to their provider to make sure that communication is maintained between the community physicians. And you're right, many times equipment at the clinic will prohibit us from doing a particular procedure, or the skill set of the providers, which may necessitate a referral to a specialist. So our goal is really to work with the physicians that are in the community and on your networked health benefit plan.
Terrific. So if I said, gee, I'd really like to have I don't have a specialist for this particular situation, but I would like to have somebody near my home, that would be something you'd be able to work with? Or if I wanted someone near the office, you could do that?
Absolutely, absolutely. We will work with the physicians that are on your network plans, and certainly support them in any way we can.